Hi, it's Murray Sapre. I want you to remember this. A disorder is not a disease. I'm going to say it one more time. A disorder is not a disease. Well, then you might ask, what is a disorder? A disorder is usually something that is clinically significant, meaning it is causing enough challenges in your thoughts, feelings, or behaviors that leads you to speak to a mental health care professional. So when patients are wondering what's permanent, what's not, this means the symptoms of disorders may come and go. So, as a clinician, we have to do our best work to remind patients that oftentimes the symptoms may be there, but we can work around them. That's a huge difference between a disorder and a disease. Oftentimes, with disease, there may be some symptoms there that are masked or covered for a period of time, but typically things are still there. With a disorder, we can work on these impairments oftentimes, and sometimes we can get them totally resolved. So remember, a disorder is not a disease. The next time you have a challenge that leads you to speak to a mental health care professional, work on strategies to eradicate the challenges from disorders. Remember, the disorders come in the forms of mental functioning, sometimes your physical functioning, or your emotional functioning, and you'll see them in your thoughts, feelings, and behaviors. So remember, a disorder is not a disease.